Hi, I'm Lisa Entwistle, founder of Wealthy Living and host of the Wealthy Living radio show. Each fortnight, I'll be having conversations with a variety of different professionals to discuss topics that cover all areas of wellness, physical, emotional, spiritual, and otherwise. We'll discuss how our choices impact our work, our relationships, and our health, and suggest ways to help you live a wealthy life. I help open-minded, big-hearted people connect to themselves, others, and the world around them, guiding them to live a wealthy life, both personally and professionally. So today I have a very impressive guest who has so many titles, and none of them are short of impressive. So my guest today is Dr. Catherine Kroc. She's been a physician at the Royal Children's Hospital in Melbourne, a medical pioneer, a producer of music and theatre. She's a wife and a mother of 5. She is the chair and founder of the Hush Foundation, a non-for-profit organisation working to transform the culture of healthcare through the arts, aiming to reduce stress and anxiety in healthcare settings and beyond. In 2009, Catherine founded the Australian Institute for Patient and Family-Centred Care, which merged with Hush Foundation in 2016. She also co-founded The Gathering of Kindness, a grassroots movement that seeks to address bullying and poor culture in healthcare by focusing on building a kind health system. Catherine is a true change maker and influencer in areas of medical innovation and the arts, fueled by her desire to implement meaningful change in healthcare from the inside out. She believes this will benefit the users of healthcare, patients and their families, as well as the hundreds of thousands of women and men who work in the field. If that's not enough to exhaust any reasonable person, Catherine is also an active keynote speaker and panellist in Melbourne, Australia. She is truly a remarkable woman and by no surprise has received a number of accolades. There are many which I will include in the show notes, but just to mention two of them out of probably almost 10 of them. Catherine won the Australian Financial Review's 100 Women of Influence in 2014 and in 2015 became a member of the Order of Australia for services to medicine, to community healthcare standards and to the arts. So it gives me so much pleasure to welcome Catherine today. So welcome.
Thank you, Lisa. It's great to be here.
Yes, it's absolute pleasure to have you here. I thought about cutting that bio short a bit because it's so long, but it's so impressive and there is so much in there that I felt that it was necessary to share all of that, and I probably could have gone on even further. So I think what would be really good for the listeners today is maybe if we can start with your story a little bit. So as a trained medical practitioner, entering into or working with the Royal Children's since the
1994.
Yes, so that's a really long time and that you've done so much since then, and I'm sure when you entered the system you would probably have just seen yourself being a doctor like other people that come out of healthcare and come out of medical school, and but you've come so far from them doing so many things to make such a difference within the healthcare system. So maybe you can just tell the listeners a little bit about your story.
Well, Lisa, I came back to work part-time in 1994 with 4 young children at home and no plan at all to try and change anything. I just literally thought I'll do a bit of part-time work to keep my hand in. And I've always been very shy and retiring and not really spoken up for much. But what I found when I got back to work was we were restraining children to do procedures on them in treatment rooms without adequate pain management. And I think having young children myself, I thought, hang on a sec, if this was happening to one of my children, how would this be? My job that I had started in those days was looking after children with leukemia and other serious illnesses. And these children come for multiple procedures, and it was my job to do lumbar punctures and bone marrows on them. And I did something a little bit unusual at that time, and I sat down with a group of parents and I said, tell me about your journey when you've got a child with a serious illness. It seemed obvious to me that I needed to hear from the people who were being impacted by the care. So we got a plate of sandwiches. We actually called ourselves a little group called Together We Achieve, which was sort of the start of what is patient-centred care to me. So we sat around this table and I'd say, tell me the touch points in this journey that we could help you to improve. And the first thing they said was the pain management for the procedures. We get really stressed, and in fact, our children get stressed for days before we have to come, and we would like that to be different. The thing about it is, once you've got that sort of information, then you can do something with it. Us health professionals, we're doing really hard jobs. We're working the best we possibly can. If we don't have that sort of information, we don't know that we could be doing better.
Yeah. So in gaining that information, so you had feedback from the parents of the patients, and they shared with you about the challenges that they faced, especially with this situation with the pain management. But in order to make changes there, when you're working within an organisation, so a big organisation, the Royal Children's Hospital, how was that received, and what were the challenges to be able to answer the call to what the parents or the patients were communicating, and still being able to fit within the, I suppose, policies and procedures of an organisation or a hospital? So,
good question. It is quite a challenge, and there was a bit of juggling back in those days because we were not used to patient and family feedback, and some people saw that as a bit of a threat to how we were doing things and a criticism. But in actual fact, the parents were just amazingly collaborative about it, and they were really delighted to be listened to and to feel that they could be part of making the changes. And it really was the involvement of the parents that helped us to shift some of the culture of people thinking, no, we're the health professionals, we know what's best. Then hearing this really sensible conversation from parents who said, if you improve the pain management in this bit, that would be better. If you brought some music and some other things into the operating theatres and treatment rooms, that would really help reduce anxiety. If you restructured your booking systems for things like theatre, so when we were putting children to sleep for procedures, we would still bring 12 families in at 7 a.m. Now, we had no intention of being able to do all those children. Some of them wouldn't be finished till 12:30, by which time there was chaos in the waiting room, everybody's upset and crying, and the parents would say to me, that doesn't make sense for the children who are fasted, who are getting stressed, for the parents who are listening to it, and also for the staff. So the parents think about us too. They want us to be in our best possible condition to be able to look after their children. And the noise was then elevating everybody's anxiety.
Yeah.
So it was so collaborative and really good, because once we'd heard that, we thought, okay, let's structure theatre admissions so that we have a small group of children at 8 o'clock, a small group at 9:30 and a small group at 11.
Yeah. I mean, to me, it sounds genius. You know, it sounds like the best approach, not only in a system like the hospital system, but in all systems whereby just the management or in your case, the medical team don't always know best, and to get the input and the feedback from every person within an organisation, whether it be the education system and speaking to parents and students and teachers and principals and everybody coming together to give their input, but not just giving their input through a survey, but actually the input being received and actioned. And then same with the healthcare system, like you discussed, or even in a corporate environment, it's the influence of everyone. And I think that I am seeing the more people that I speak to and the more that I'm reading, there is a cultural shift starting, where the feedback system is being recognised as having a positive outcome
This
and
is
adding value.
exactly. It's so valuable and so exciting when it works.
Yeah.
This was like opening the floodgates to us to hear some really useful information from people who are seeing it from a totally different perspective.
That's right.
The parents are sitting in a plastic chair watching and seeing everything that's going on and hearing all these things, yet nobody had been tapping into that and saying, what have you noticed? What do you know?
Yeah.
And the patient safety aspect of involving them closely was fantastic.
Yes.
Because they do actually see things that just look a little bit different, almost like when you see it at the airport. You know, if you notice anything, say something.
Yeah.
We need to upskill everybody in healthcare to be saying, oh, hang on, that medicine looks a little bit different from what I had last time. Can we just check it before we go on?
That's right. Just giving merit to
observation. That's right.
To the parents, to the patients,
Yep.
and not actually, for them, I suppose the medical, not just the medical staff, but just to the decision makers in the medical, like the people that are dispensing the medication, to not have necessarily all the power and to be a bit humble, the fact that maybe they can also make mistakes, and to listen when someone's pointing it out, as opposed to taking the approach of, well, there's no way I could make a
That's
mistake.
right, we know best.
Yeah.
And I think the healthcare culture has struggled a little bit to come to terms with that without feeling threatened. But once you have come to this realisation that everybody's input can help keep people safe, it's the obvious way to go. And it's been really empowering to everybody,
Of course.
to say, we can take this feedback, on our shoulders, and then we can do something with it. And everybody will be in a better position.
So, when you hear this feedback, it's kind of like stuff, as especially for you, who really was, instigated it, and obviously with the intention of really wanting to listen properly and action it. Once you heard it and you heard that feedback and you heard things that maybe you hadn't noticed before, you can't unhear that stuff.
No, that's right.
Right?
No turning back.
There's no turning back. So once you hear it, you almost get, especially as a change maker, a bee in your bonnet that you have to do something about it. But I can imagine that in this system, it wasn't necessarily an easy thing to bring about change in those areas.
No. And I was mindful that I didn't want people to think I was being critical of how we'd been doing it before. This was more like a positive, let's all move forward and improve based on this feedback. And got a few knockbacks from people saying, well, you can't change this, it's always been done this way. Why are you making the parents complain? Was another criticism. In fact, there was no complaints. The parents were joyful in their providing feedback back and telling us what would make a difference to them.
So just for the listeners today, if they're in a position where they really feel like they want to bring about change in whatever industry that they're in, but there is a resistance, there are people which are wearing a different lens than them. So they've got a different perception, like you just shared, that, some people were taking that as parents complaining when that's not actually what was happening.
Yeah.
Right? So there's always going to be people who may hold the power a little bit more at that particular time in the organisation, which are pushing back from the change that you're trying to bring about. So what sort of advice could you give a listener today that is trying to bring about a change, but it just feels like an uphill battle?
Yes.
How do they keep going? How do they find the inspiration? How do they get other people to, you can't change other people's minds, but you can maybe communicate in a way that opens up their lens.
Yeah.
So from your experience, what sort of advice could you give?
There are a couple of things. First of all, make sure you're really well armed with the facts and the science. So I looked at a whole lot of medical literature about people around the world doing things differently than how we were doing it. And some places were more advanced and some were behind.
Yep.
So just being well armed with the knowledge so that you're not caught off guard and people say, well, it's not safe to be doing this particular thing. So I knew what I was talking about at the time.
Yep.
Also, you need to get some really good